So one more about workers fighting
So,
back and workers not putting up with it anymore. And this is a little closer to home. Buffalo, New York. More than 2,000 nurses and other healthcare workers are on strike at a hospital. Okay, and they're fighting for better wages, staffing, and working conditions at Mercy Hospital.
yep.
Okay, they describe horrific conditions. Patients' rooms, hallways, cafeterias, even medical equipment are filthy because they refuse to hire enough workers.
Yep.
Okay, very dirty, very low staff. Morale is terrible. Culture's terrible. Yeesh.
It's
That,
almost like it shouldn't be privatized. Almost like that might be the case.
yeah, here. If someone dies, I should be able to spend time with their family. Instead, I have to run out of the room and hope that my other patients are still alive or breathing and stable. Oh,
Yep.
wow.
Welcome to the ICU.
And environmental service workers say they're paid less than $14 an hour. Nurse staffing levels is also a major issue. One nurse said that instead of having 11 nurses and 5 aides for a 40 care patient unit, they often only have 5 nurses and 2 aides. They're on half coverage. Isn't a bit? No, the Nabisco strike was settled, Eric.
Yeah, they
Um,
yeah, they settled.
they
Heard
got
like
slightly
terrible stuff
better,
of
but it
like
wasn't
yeah.
anything close to what they actually wanted. And of course, the WSWS would call that a sellout contract. It got them something, but got them
Yep.
back to work, most importantly, and allowed me to still eat my strawberry Newtons going forward because I did boycott all
Yeah.
my Nabisco stuff while they were on strike.
Nabisco.
Um, Another nurse said that there are times when her coworkers are in tears due to stress and inability, given massive levels of overwork, due to properly care. It's just it's absolutely heartbreaking. All this. Catholic Healthcare Workers Union, Communication Workers of America, Local 1333, held negotiations throughout the night. Hospital said in a statement it offered a contract with a 3% raise in the first year, 2% each year after that, well below the current rate of inflation of 5% here. Right? Exactly. Ritz crackers, That must be a Ritz. That must be a Ritz.
God, you
That's my that's
brand
my
loyalists, you.
that's my Eddie Murphy impression. Um,
What, you
so
can't drink Mr. Pibb? God.
no, I can't drink Mr. Pibb.
Uh, this segment brought to you by water. Sponsor for the
Yes.
show, water.
Oh,
It's
and
very,
an
very delicious,
unofficial
hydrating.
and an unpaid supporter of the show, Dunkin' Donuts.
Dunkin'
Dunkin'
Donuts,
Donuts.
way
If
to
you
go.
ever wanted to sponsor a show, I am drinking your French vanilla
Yes,
every single show. I promise. Um,
he will take your new and improved coffee IVs. Um,
uh, Job
you
posters
know,
showing the firm is paying as much as $150 an hour for RNs who will cross the picket line. And what do RNs get paid? They don't get paid $150 an hour, but they know that it's temporary. And they know they're hiring scabs. And they know that they have to, that these
yep.
people, in order to really do that, it's like, well, what do you want me to do? I work a
There's
5 hour shift and I'm making $750. Well, I mean, they got bills to pay. I mean, it's how much solidarity can you do? And hopefully it's full solidarity. It doesn't matter how much, but I can't stand in their shoes and make that decision for them. And everybody's got to make their own choices. I stand with these nurses. I stand with these striking workers. I stand with all the workers to get better conditions. Dirty conditions, dirty hospitals, half-staffed nursing floors. All told, the industry made $1.85 trillion in revenue, right? With profit margins over 8%. Right? Conditions have only gotten worse throughout the pandemic. All right. The WHO reports at least 115,000 workers have died, right, from
jeez.
COVID. In the U.S., a Kaiser Health
Yeah.
study found that 3,600 healthcare workers had died in the 7 months since March. Nurses making up 32% of the casualties, so they're most at risk with exposure. Again, long article. Highly encourage you to read it, to sign up for email alerts from WSWS.org. It's at the bottom of every bottom of every article, and when you go to the website as well.